Good evening and thanks for tuning in. Living the city life can have its perks, including prime access to health care. For those living in the rural part of the Peace Garden state, studies show access to behavioral health care is 60% more limited than those in more urban areas. Haley Burchett spoke to a healthcare expert and a family farm owner to learn more.
For families like the Sodders, living and working on a farm can be overwhelming. Having to travel long distances for medical appointments cuts into other things, including class time.
Sometimes you have to make those hours up before or after school because they don't understand the assignment or the teacher didn't have time to explain to them, and stuff like that, because they left at 1 o'clock to get to therapy by 2, because it is an hour drive.
The Bipartisan Policy Center released a report on behavioral health integration and combining primary care and mental health in rural areas. The report indicates that 60% of rural counties lack psychiatrists and half lack psychologists. Practitioners are likely to remain providers where they train, and that is usually in a city hospital, diminishing the rural workforce.
When you're able to tackle primary care and behavioral health care earlier, more immediately, and more often, you don't have folks not getting the health care they need until things are really bad and they need to perhaps be hospitalized.
Kendall Strong with the Policy Center also says people should treat their mental health the same way they would any other condition, and that the stigma associated with seeking help needs to be removed.
Even, the old farmer's wife who thinks she's way busier than a mom with, 4 busy children or 5 busy children, whatever it may be. Everybody needs that soundboard. Even if they don't think they need the mental health, everybody does deep down.
Strong emphasizes that only through recognizing small policy changes with the collective effort of patients, advocates, and providers will rural access to care improve. In Donnybrook, I'm Haley Burchett reporting for your news leader.
The Policy Center hopes that its recommendations will help boost the rural workforce pipeline by integrating care. They also want to get Congress involved to get the ball rolling on rural health care initiatives.